Hello and welcome to this episode of Latitude, in which we are looking at a subject which is not just strategic, but a subject that has implications for the whole world. And that is the resurgence of COVID and related infections in China, which has got everybody in a situation where the international community fears that China perhaps was said to be suppressing the information was to ensure that its own economy doesn't slow down any further from the huge percentages at which it was growing earlier, down to say 2.5 or 3 or 3.5 or 4%. There are all kind of mixed assessments. But right now we're looking at the resurgence of COVID. Official figures are over 60,000 casualties or victims, and unofficial figures are many, many times higher. We have two experts who are going to explain the importance of what China is doing or could do to the world economy. And we have a medical expert who will help us understand the medical dimension. So we have with us for the first time on the show, the eminent Dr. Jalil Parkar, who is not just a consultant at the Lilavati Hospital in Mumbai, but has attended to close to 1,000 or more COVID patients and has been a victim of COVID himself at one stage, and has been a professor both at the postgraduate and at the undergraduate level of medical sciences. You will see what he has to say and understand the expertise he brings on the table. And we have with us our regular China expert, Professor Kondapalli of Jawaharlal Nehru University, who is really the man to go to on China issues at JNU and is heading the center there. So I'll start with you, Professor Kondapalli. Now, can you explain to us in simple terms the impact the current crisis that China has created, partly because of its own internal mismanagement, on the fallout that it could have and the impact it could have on the world economy?
Thank you very much, Mr. Maroof Raza, for having me on this show, and to the fellow panelists, Dr. Jalil Parkar. When the first cases of infections were reported in October 2019, there was, of course, the surprise element that this is a new variant of the coronavirus. And soon some 50-odd cases were reported. And the Chinese health system was not able to really cope up with that influx of these infections. And by January 24th, 2020, the Chinese locked up Wuhan because the spread of the virus has been very intensive. And prior to that, the mayor of Wuhan gave a TV interview where he said 5 million people have left Wuhan prior to the lockdown. So that is where the those with infections or those who are asymptomatic cases must have left as well. It is estimated that 452,000 people left for the United States from Wuhan, and many also left, thousands left to Lombardy in Italy, Spain, and then some also went to Iran, Qom in Iran. So that was the spread, but majority of them actually went inside the different provinces of China. So once the lockdown has been announced on January 24, 2020, the Chinese have insisted on the lockdown conditions for the rest of the country as well, as the virus spread. So at one time, some 400 million people were infected, even though there is the lockdown in at least 17 cities in China and places. Now, for 2.5 years, they went on by saying that they were more open, transparent, and efficient in tackling the coronavirus. However, on November 20 this year, last year, And on November 30th, they had mentioned the flexibility in the dynamic zero COVID policy. And they have lifted the lockdown conditions from many cities, states, as the protests on the last week of November increased in China, because in Xinjiang, in Urumqi city, capital city of Xinjiang, there was the fire incident, and some 12 people were killed when the lockdown condition has, increased the vulnerability of people who are in the lockdown situation. So with that, the Chinese have opened up, and today, according to Airfinity in UK, a think tank, and also the BBC, they have reported that some 230 million people in China must be infected with the virus. And Airfinity suggested to 5,000 to 6,000 casualties a day. And yesterday they revised the estimates by suggesting 36,000 a day are dead in China. So what we hear is that there is a lot of infections and the death rates. However, the National Health Commission, the nodal agency, did not give any figures so far. In fact, their figures were just about 26, 36 in each of these towns and cities. And so obviously there is some obfuscation of the statistics in China in this regard.
Okay, so you've given us a very grim and a comprehensive picture about what is unfolding in China. I'll come back to you to ask you as to how it is going to be contained by countries where Chinese nationals have headed for, as you said, US, Europe, and you haven't mentioned Southeast Asia, but that's a point of concern for all of us. But Dr. Parkar, sir, I want you to make us understand, how is this any different from the COVID that we had faced in wave 1 and wave 2? How is it that we are any better prepared this time than last time?
See, the first wave that came into, I think nobody knew about COVID whatsoever. Each one tried their own medications and they said that they were successful, but eventually I think they were not. We followed the Bangladesh regime over here, which was ivermectin, doxycycline. People had started with steroids and doxycycline. And then came in the injectable medicines that were there, which were tocilizumab and Tamiflu, etc., etc. We even gave plasma therapy. But what happened after the first wave was that isolation was of prime regard. Taking care, wearing mask was of prime importance, etc. Then came in the second wave. By this time, I think things became even worse and we had started our immunization program. But unfortunately, the wave was so hard-hitting, it was like a tsunami, and many of the patients, they did die. Now, what we are talking about is the immunization program, which has been very robust by the Indian government. We have been to each and every village possible, in spite of all the limitations that we have with a humongous population that we should not forget. More so, we don't have the facilities like the Western world, the developed countries had, but yet they did even worse than us. So kudos to our government that we did a wonderful job. And now that this wave has come, I think it is not affecting many. It is like any other virus that is coming into the picture. Yes, it is spreading across, you could say, a lot, but it is contained because I have not seen any hospitalizations and I have not seen any patient requiring to stay in the hospital. Yes, they have upper respiratory, lower respiratory tract infections like any viral, and they are getting their treatment and they are going back home. The oxygen requirement also is bare minimum. So I don't think we should worry about. On the contrary, I would say that we are better off in spite of, the media creating a confusion amongst all the citizens, various channels, you could say. People are more nowadays reading, and we call them the Dr. Googleshwar, because they Google and they see. As regards to China, I'm surprised. I'm not surprised, but what I heard of Mr. Srikanth Kondapalli, that what was told as to the number of deaths and what was actually declared by the Chinese government, there's a remarkable difference. Now that itself brings in, I would say, a suspicious doubt as to what is the factuality over there.
Right. So we'll look at that in the second half, and why the Chinese system has completely failed to address the issues, but that after a break. Welcome back. We are continuing to have our two experts with us, and we are looking at the spread of this new virus and a pandemic, and a bigger than a pandemic situation in China itself. But what could be its implications for the rest of the world? And India, our two experts are helping us understand. Professor Kondapalli, who is still with us, may I ask you to explain that why the international community is not being able to provide any expertise or help or support to China when the figures are known to people like you, and so should they be to so many other experts and agencies all over the world, and especially the intelligence agencies. And you also talked about people going to the US and Europe, and what about Southeast Asia? So, I mean, it's going to spread again all over the world, though Dr. Jalil Parker's remarks are comforting, and it's not going to be hopefully as bad as it was in the second wave of COVID. Your views, sir?
Well, on the last part of that question, how did it spread to Southeast Asia? The first case was reported in January 2020 itself in Bangkok in January 2020. So the Thailand authorities isolated that patient, and the spread of the virus has been stalled for the time being in Thailand. Of course, these are all porous borders with Myanmar, Laos, Cambodia, and other places. So it spread over to the rest of Southeast Asia from that point of view. But on the first part of your query, there is the issue of Chinese vaccine nationalism. For example, the Chinese Sinopharm and another vaccine were developed in China. And although China had donated or even sold at higher prices the Sinopharm vaccine to the rest of the world, the Brazilians found that this is only 56% effective. And hence there is the issue of the standards of the vaccine that China generated. Number two is the Chinese have did not allow any other vaccine developed across the globe to be incorporated into China. For example, the Sputnik, the AstraZeneca, the Johnson & Johnson, or other vaccines that were developed, none of these were allowed into China because of the vaccine nationalism. And even though they have given nearly 2 billion doses of vaccines, the elderly were not given those vaccines because of the blood clotting and other issues. So the elderly were most vulnerable in China, and most of the casualties must have been with the elderly people in China. So that is
a question here. Sorry, I normally don't interrupt, but I want, since paucity of time is there, I want you to explain that, apparently fearing that China's economic confusion that will follow with all the spread of COVID, the US and many other European countries had decided that they wanted to shift their activities, especially economic activities, which are connected with China to other countries in Southeast Asia, interestingly. And as you said, they have porous borders. So even if they were to shift their activities to those countries in Southeast Asia, whether it's Malaysia, whether it was Thailand or elsewhere, eventually, wouldn't it impact on global economies like the US through those other alternate destinations?
Indeed, it did impact on the alternative destinations. And that is the reason why last 2.5 years, the IMF and World Bank have predicted very low growth rates, very low trade, and disruption in the supply chain mechanism. That affected everybody. Except for electronics, except for pharmaceuticals and e-commerce platforms, all the other sectors have actually gone down across the globe and also within China because they have put every other city in the lockdown condition. So there was no factory output. And so there is the decline. Last year, China grew at 3%, for example, from a peak of 6% before the COVID. So half the GDP is gone in the Chinese context. This is across the globe, as the international financial institutions have mentioned in the statistical output. So there is a gradual decline. And also the double whammy is the decoupling process between the Trump administration and China, and continued during the Biden administration with China. And on October 7th, last year, there was the $130 billion ban on the semiconductor imports by Huawei and ZTE, and this has also further complicated the situation. There is a overall policy directive by the Japanese, by the Americans, by Europeans to shift from China market to the others. And as you know, the Foxconn has shifted much of their iPhone manufacturing towards India now. And iPhone 14 is being manufactured in India. Changzhou in China has been shut down, which used to manufacture for the rest of the world these iPhones. So there has been a perceptible shift from the China market to that of the rest of the world, first to Southeast Asia and then to India now, increasingly. 220 American companies have shifted, although there are thousands of these still in China. The European chambers of commerce are also very concerned about the situation in China regarding the COVID. So it did impact on the economy substantially, and also in a negative manner, the Chinese economic growth rates, etc.
Okay. So that's comprehensive enough. Once again, thank you very much. So Dr. Parkar, sir, now I want you to help us understand that this entire medical condition that people are fearing, that is a fallout of what might come from this COVID burst. How can it be confronted any better in India than what we are already doing, since we have a large population that is vaccinated? And as you said, vaccination itself helps a great deal. So the steps the Indian government is taking now, is it purely because of media pressure, or is it because of medical advice?
It's not just because of media pressure. No, medical advice is of prime importance, and I think the Indian government does not want its own citizens to suffer like they have suffered in the first wave and second wave. And why not? I think whatever they think is thought about very diligently, and those steps are taken. They are not taken haphazard just like that. Otherwise, with this Chinese wave that was coming in, we all would have, again had to suffer. Again, people would have gone to their villages, etc. So I think the medical advice that is given to the central government is appropriate, and because of which I think the government is taking the necessary steps. They have also reopened the vaccination, etc., which was not there for those who have not taken the booster dose, etc. So, and wearing of masks, that was advised. I think it is reasonably a good step that is taken rather than, forcing things upon the citizens, which in eventuality hurts the economy.
Is certainly better than cure. So
Uh-huh.
there's no harm if you take preventive steps, and if your society and your citizens are healthy. If China's example is one thing that should set alarm bells going, that if the society is medically contaminated and is under the kind of pressures that this wave has brought onto China, their economy has no choice but not to grow, but to dive downwards, which is what is feared by the IMF and other organizations, because that in turn will obviously have implications for the global economy. And this year is being predicted to be not a very good one for growth in the global economy for a variety of reasons, from the war in Ukraine to the pandemic in China. But thank you very much for both of you, to your expertise and to at least clear the minds of so many of us through your expert comments and your wisdom. And I hope we'll have you probably again on a happier note in another show. But until then, let us say goodbye to our viewers, and to you, thank you very much.
Thank you.